In this video, we're going to talk about how to use a pelvic wand to do internal muscle release for your pelvic floor. So a pelvic wand is really just used instead of what a clinician would use for their finger to do internal work. It has this hook on the end that's really just shaped the same way that the finger would be to do some of this muscle release, except it's used as a tool that you can use at home. So we have two different ends. This is the end that a majority of my patients are using, although this side can be used as well. It's typically used more rectally and this more vaginally, but it can be used for either or. I just like the contour of the shape so we can kind of hook into some of these pelvic floor muscles. So I want you to think of this similar to a theracane that you would use on your body to kind of press into tight muscles and get those to release a little bit. Except you're using this internally. So on the pelvic model here, we're going to go kind of right into the vaginal opening and onto some of this soft tissue. You can go into most areas of the pelvic floor and work your way through any of these tissues that are right in the middle here. So anything in red is muscle. This is going to be an area that you can go ahead and release tension based on how the clinician is kind of telling you how to navigate through your body and how to use this device. But for most people, we'll insert vaginally, and then you're hooking this onto some of the muscles into the pelvic floor and pressing just with the same pressure you would use to kind of bruise an apple. So you're poking into the muscle, holding about 10 or 15 seconds, and finding one of these tender spots. That's where you want to spend some of your time. So you press into that tender area, holding about 10 to 15 seconds, using the deep breathing techniques that we've talked about to try to get some of this muscle tension to release and stop clenching so much. So again, this is really just a tool, but it's used in order to do some internal release work on yourself without needing a clinician right nearby. Again, we insert this vaginally and we can really hook onto any of these muscles, even our deepest layer, the obturators, our piriformis muscle. All of this can be done internally to help release some of those tight muscles.